Senator Cormann.
Thank you, Madam Acting Deputy President. We are debating one of the many broken promises of the Rudd government in the health portfolio. As we discussed a few weeks ago, before the election we were promised the world by the Rudd government on health, and they've delivered next to nothing. We were promised that they would fix public hospitals, and if not enough progress had been made by the middle of 2009, they would move to take over the running of public hospitals in Canberra. We were promised that they would leave intact, that they would retain the existing private health insurance rebates, that they would retain the private health insurance policy framework put in place by the Howard government, which helped to restore balance to our health system. And of course, we were promised by the Rudd Labor government before the election that they would not reduce the extended Medicare safety net. And we were promised a new era of cooperative federalism on health, the Commonwealth working together with the states and territories to fix our health system. And we've had broken promises after broken promises after broken promises. Our public hospitals are under more pressure now than when the Rudd government was elected. Waiting times, average waiting times for elective surgery are now longer than what they were when the Rudd government was elected. And what have we had? We had a review for 20 months, the National Health and Hospital Reform Commission process, only to be followed by a review of the review. We now have the Prime Minister and the Minister for Health, Nicola Roxon, travelling around Australia for photo opportunity after photo opportunity, just to essentially make it look as if they're doing something. No progress whatsoever, no action, no outcomes, only bureaucratic processes and a political strategy to make people believe that there is something happening when there is nothing happening. Now, the private health insurance rebate promise was one of the most emphatic promises before the election. The Rudd Labor government was going to retain the existing private health insurance rebates. It was repeated by the Prime Minister, it was repeated by the now Health Minister Nicola Roxon again and again. Indeed, no ifs or buts, as Senator Barnett quite rightly says. And in fact, in Tasmania, Nicola Roxon, the then Shadow Minister for Health, put out a press release accusing the coalition of running a scare campaign because we dare to question the sincerity of this commitment. And of course, the record is now here for all to see. Labor, as soon as they got back into government, they returned to their bad old-fashioned ideological crusade against private health. They said they wouldn't do it, but of course they have. Now, and this is a very bad public policy measure for a range of reasons. Firstly, it will put more pressure on public hospitals that are already under pressure. It will see more people leave the private health system. And I mean, the government agrees with this. We might have some arguments about the figures, but the government agrees with this. It will see more people leave the private health system. Millions of people with private health insurance will see an immediate increase in the cost of their private health insurance. Millions of people will see an immediate increase in the cost of their private health insurance, up to 66.7%. We will see more people leave. There will be flow-on consequences. There will be flow-on consequences year on year as more people leave. There will be more pressure on premiums, more people will leave, and we will end up back in that vicious downward membership cycle that we've experienced in the 80s and early 90s. And of course, the Rudd government had promised us that this would no longer happen, that now they had learned from their mistakes of the past, that seen how, what a bad impact these sorts of measures had on the health system when they last were in government, it wouldn't happen. But of course, it has. Now, the government has done some modelling, and the modelling, as always, is part of a political exercise. The modelling underestimates the impact of this measure in terms of the number of people that will leave private health. It underestimates the impact on public hospitals, and it underestimates, well, it doesn't assess at all the impact on future premium increases. Why does it? Firstly, they've excluded 1.4 million privately insured Australians from their calculations, excluded them altogether. And then secondly, they've made the heroic assumption, the absolutely heroic assumption, that nobody will downgrade their level of cover as a result of this measure. Now, Madam Acting Deputy President, experts, including those experts who say that they support what the government is doing, so not those that are supporters of the private health system by and large, would say to you that the most rational decision of anybody that is caught by this measure would be to downgrade the level of cover. And the reason for that is because of the combined effect of the rebate reduction measures and the increases in the Medicare levy surcharge. Now the government heroically says, no, it's not going to happen. Now reducing level of cover means that people will face increased gaps, or that they will have to go to the public system to access those procedures which they have excluded from their level of cover. Now, Madam Acting Deputy President, the Coalition has made a very constructive proposal on how we could actually achieve the same fiscal outcome for the budget, in fact a better fiscal outcome for the budget, in a better way for the health system. The Leader of the Opposition, Malcolm Turnbull, proposed that we should, instead of pursuing this broken promise of the Rudd Labour government, that we should increase the excise on tobacco by 12.5%. Now again, what did we get from the government? A political exercise. They tried to go out there and talk it down and selectively leaked some Treasury advice. But of course, thank God for the opportunity of Senate estimates. Thank God that we were able to ask some questions of Treasury, because we know that unlike what the Rudd Labour government tried to make people believe, that an increase by 12.5% of the excise in tobacco will raise $2.2 billion, which would more than offset the cost of not going ahead with the means testing of the private health insurance rebate, which of course would save about $1.9 billion. $2.2 billion in additional revenue versus $1.9 billion in a budget cut means that the budget will be $300 million better off. People will be better off because of reduced levels of smoking. The health system will be better off. There will be less pressure on public hospitals instead of more. But instead of embracing the very constructive proposal that the opposition has put forward, of course, all we've had from the government is sneering. Now, this is part of an overall agenda. I mean, we've discussed earlier today the changes to the extended Medicare safety net, another part of the ongoing crusade against people who access healthcare services through the private system. Before the election, we were promised it wouldn't happen. Before the election, we were promised that Labor now was committed to both a strong public and a strong private system, that they were now committed to ensuring we've got the right balance in our health system. Instead, what we've had is broken promise after broken promise. This is bad public policy. The opposition will be opposed to this legislation, will vote against it at every step of the way, and we will hope that the Senate will join us in defeating what is a very, very bad piece of legislation.